If you're about to turn 65 and you're getting bombarded with so much information about Medicare and you find yourself scratching your head wondering, where do I even begin? Well, then you're in the right place. In this video, I'll go over everything you need to know and do in the months leading up to your 65th birthday so you can avoid Medicare's permanent fees and penalties, avoid getting permanently locked out of Medicare plans for next year, and get the best possible coverage for your situation.
The best, Jerry, the best.
I'm Calvin from PlanFit, and I've been helping seniors with Medicare for 14 years now. And today I'm going to help you prepare for your 65th birthday in plain and simple English. Today I'm going to show you the 3 steps that you need to take before you turn 65 and what you need to do during each of these steps. Now the 3 stages are 1, the planning stage, which is 6 months before you turn 65. 2, the sign-up stage, which is the 3 months before you turn 65, and then 3, the preparation stage, which is 1 month before you turn 65. And stick around to the end of this video because I'll go over some of the important things that you need to do every year to avoid wasting hundreds of dollars on your Medicare plan. So there's a lot to go over, so let's get started with the planning stage. The goal of the planning stage is really to answer 3 questions. 1, am I going to enroll in Medicare? If yes, then 2, do I need to get a Medicare supplement or a Medicare Advantage plan? And then finally 3, which specific Medicare supplement or Medicare Advantage plan should I sign up for? By the end of the planning stage, you should already know exactly which plan you're going to sign up for. And remember, this is 6 months before you're turning 65. Honestly, you can start this stage at any time, of course, before you turn 65, but you want to be sure that around 6 months before you turn 65, you're ready for everything and you know what you're going to do. Now, getting into our checklist, a lot of people believe that you're required to enroll in Medicare, but you're actually not required to enroll in Medicare. And that's exactly what this part of the planning stage is about. It's finding out, should you enroll in Medicare or not? To do this, you'll want to study what original Medicare Parts A and B are and what they cover. You'll also want to decide if you're going to keep your work coverage if you have it, if you're working past 65. Now, first up, knowing exactly what Medicare Parts A and B covered, which is called Original Medicare, is super important. This is the backbone of Medicare. Now, Part A takes care of your hospital costs, while Part B deals with your outpatient needs. Things like visiting the doctor and having a surgery, etc., those are Part B. Medicare Parts A and B together cover roughly 80% of your healthcare costs, and to cover the remaining 20%, you'll need to consider either a Medicare supplement plan or a Medicare Advantage plan, which I'll talk about here in a bit. Now, one thing you'll find out about Original Medicare, particularly about Part B, is that if you are late to enroll, you'll get a permanent penalty on your premium that could last the rest of your life. You see, there's a 7-month window where you can enroll in Original Medicare. It starts 3 months before your birth month, includes the birth month, and then ends 3 months after your birth month. The late enrollment penalty increases your Part B premium by 10% for every year you postponed enrolling. That's why it's really important that you do your research and you enroll when you're supposed to. Now, once you understand what exactly Parts A and B are, the next thing you need to decide is if you're going to continue working or not. If you or your spouse are on a company health insurance plan and your company has 20 or more employees, you could delay Medicare without getting penalties. Now, you can delay getting your Medicare as long as you or your spouse are working with the company that you're at, or until you lose coverage, whichever comes first. Now, it doesn't mean that you want to stay with your group plan. Sometimes it's better to go to Medicare, and we need to look at that. If you stay with your group plan, when you lose coverage, you'll get a special enrollment period for Medicare, which runs for 8 months, and you won't get a late enrollment penalty if you sign up during that special enrollment period. So 6 months before you turn 65, it's a good idea to compare your current health insurance with Medicare, because if your current plan is better, then you don't have to make any changes. But if you decide to get Medicare, the next thing you'll need to do is research Medicare Advantage and Medicare supplement plans. Remember, Original Medicare only covers 80% of your healthcare costs. There's no cap on the remaining 20%, so you could end up paying thousands or even tens of thousands of dollars for hospital or other medical services on Original Medicare. The good news is that you have 2 really good options for the remaining 20%. You could choose a Medicare Advantage plan or a Medicare supplement plan. Both of these are offered by private insurance companies, and both require that you have Original Medicare before you can enroll in them. But other than that, the 2 options are completely different. So here's a quick comparison chart between the 2 options. Medicare Advantage plans, which are also called Medicare Part C, are like private Medicare. It's Medicare offered by an insurance company. They usually have lower premiums, and some have a 0 monthly premium, which you might say is no premium at all, but a $0 monthly premium. However, if you get a Medicare Advantage plan, you'll have to use the hospitals and services that are within your insurance company's network. If your preferred doctor isn't part of the network, your Advantage plan won't cover the expense of visiting that doctor. Most Medicare Advantage plans will also include the drug coverage at no cost. That's the Medicare Part D, and it's incorporated into the plan. Now, that's different than a Medicare Supplement plan. With the Medicare Supplement plan, you choose a separate prescription drug plan. So Medicare Supplement plans are also called Medigap plans. I don't know anyone that really calls them Medigap other than some government brochures, but most people call them Medicare Supplements. And Medicare Supplements are standardized by the government. So there are 10 Medigap plans that you can choose from, namely the plan A and B, not to be confused with Medicare A and B, the plan C, D, F, G, K, L, M, and N. So it's just a whole bunch of them, and they're all letters. That can make it a bit confusing, but each plan letter is the same because it's set by the government, regardless of which insurance company that you get it from. Medigap plans tend to be the more expensive option on a monthly basis, meaning they have higher premiums than Medicare Advantage plans. But on the flip side, they don't have networks. This means you can get coverage from any doctor or any hospital or any healthcare facility as long as they accept original Medicare. Now, Medicare supplement plans do not have drug coverage included in them, so you'll need to enroll in a separate, what we call standalone Part D or standalone prescription drug plan that covers your medications. This can be a good thing though, as it allows you to choose which plan works best for you, and usually in most states there are a dozen or more to choose from. Now here's one thing about Medicare Advantage and Medicare supplement plans. Your options will vary depending on where you live. That's why it's really important that you shop for plans. You'll want to look around and compare options, because the truth is, some plans are much better for you depending on your specific needs or the medications you take or the doctors that you see. So here are some questions that you need to ask yourself when you're looking for a plan. Number 1, is your preferred doctor or facility or hospital part of the plan's network? Number 2, which prescription drugs are you taking, and does the plan cover them well? Number 3, what are the monthly premiums? Could you save money by enrolling in a plan that has all of the same doctors and benefits but has a lower monthly premium? So shopping for a plan means that you're looking at all of your options and carefully calculating which one is best for you. If you find this step a bit overwhelming, don't worry, because there are professionals who can help you with that. That's what we do. Professional Medicare insurance brokers are not employed by insurance companies, so we can help you compare all of your options in your area without bias and find the one that's best for you. So if you ever need professional help, you can call us here at PlanFit. And one other thing that's really important that you should know is that not all insurance agents are unbiased, and some are motivated by commissions. But here at PlanFit, all of our insurance agents are paid salaries. They're not compensated based on commissions. Think of it like if you were buying a car. You want to know that your salesman isn't receiving commissions, that they're just there to help you do what's best, like a CarMax or something. That's how PlanFit is. Our agents are not incentivized by commissions, so they will help you find the very best plan for your needs. All right, let's get back to the checklist. The last box to tick in the planning stage is knowing exactly what you're going to sign up for. You've studied what original Medicare is, you already know the difference between Medicare Advantage and a supplement plan, and you're ready to shop around and look at all of your options. The last thing to do in the 6 months before you turn 65 is decide what you're signing up for. You should already know what kind of coverage works best for you and which company you're going to get it from. And trust me, knowing this ahead of time is going to put your mind at ease and save you a lot of headaches later. And because you did your homework, it could potentially save you a lot of money as well. Very quickly, I just want to jump in here and say that if you're learning something new in this video, please hit the like button. Medicare is super confusing, and our mission here at PlanFit is to simplify it for everyone. By hitting like, you'll help this video reach more seniors who are struggling with Medicare. Also, if you're looking for more ways to save on Medicare, consider subscribing to our channel, because we're going to be publishing a lot of in-depth guides on Medicare in the coming weeks. Okay, let's go on to the second stage, which is the signing up stage. Now, unlike the planning stage, which has a bunch of things that you need to do, there are really only 2 boxes that you need to check in the sign-up stage. And these are number 1, enrolling in Medicare Part A and B, and number 2, enrolling in the Medicare plan that you chose. 3 months before you turn 65, you can already enroll in Medicare Part A and Part B. It's a good idea to do this as soon as possible so that you can get covered the moment you turn 65. Well, or to be more specific, you'll actually get covered the first day of the month that you are turning 65. Also, don't forget that there are permanent penalties if you sign up late. You have a full 7 months to get signed up, but it makes a lot of sense to do it as early as possible. So to sign up for Medicare, you can sign up online at ssa.gov, because Social Security is who handles the registration and sign up for Medicare. You could call Social Security at this number, or you could contact your local Social Security office. Now, if you've decided to get an Advantage plan, 3 months before your birthday is also the time to enroll in your Advantage plan. That way, your plan will take effect at the same time as your Medicare. If you're going with a Medicare supplement plan, you can enroll as early as 6 months before you're turning 65. But usually when you get your Medicare card is the right time to sign up for your Medicare supplement plan. And you also at that time, 3 months before your birthday, need to sign up for your Medicare Part D prescription drug plan. Just like with Medicare Part B, there are permanent late enrollment penalties for Medicare Part D. If you don't sign up on time, you'll have to pay an extra 1% on premiums for every month that you delay your Part D, so don't forget to enroll early. Okay, now for the last stage. Finally, 1 month before you turn 65, you should already have everything in place. If you followed the checklist so far, you won't have to do anything at this point except double check that everything is ready. By this time, you should already have your red, white, and blue Medicare card. It comes in the mail and it comes in a very normal looking envelope. I know some people who have thrown it in the garbage on accident, so be careful and watch for it. At this stage, you should also have your insurance cards for the other insurance you signed up for. If you had a Medicare supplement and a prescription drug plan, you should have 2 cards that came in the mail. One for your Medicare supplement and one for your prescription drug plan. If you signed up for a Medicare Advantage plan, then you would only receive 1 additional card that covers you for your Medicare Advantage plan. At this stage, if you have any other health insurance, you should also cancel that and tell them that you're replacing it with Medicare. And with that, you should be ready for your Medicare coverage to start. Now, before I go, there's one more bonus thing I want to tell you about, which is what you should do every year to make sure that you're not wasting hundreds of dollars on Medicare. Every year from October 15th to December 7th, you can make a change to your Medicare Advantage or prescription drug plan. That time of year is known as Medicare Annual Election Period. A lot of people call it open enrollment. It's not really open enrollment. Open enrollment is something else, but I'll save that for another video. But it's definitely something that you need to watch for and mark your calendars. Because every year, Medicare Advantage plans and Medicare Part D plans, they change their premiums. Their premiums could go up. They could change how they're covering different services. There can be changes in coverages. That's why every September or October, you'll get a notice in the mail that tells you what's changing for your next year. It's called the Annual Notice of Changes. It's so important to read through your Annual Notice of Changes because there might be big changes in your coverage from year to year. It's never a good idea to just settle in and stay with the same plan for convenience because that can cost you hundreds or even thousands of dollars down the line. Instead, once you get a list of these changes, you should look around and make sure that you want to stay with that plan or if there's a better plan out there for you. Not checking to see if there are better options is one of the biggest Medicare mistakes that people make every year. Again, if you're overwhelmed, don't hesitate to give us a call. Some of these things are things that we can do for you. And of course, there's never any cost to our services. Also, there's a lot of false advertising out there, especially about Medicare Advantage plans. And we'll help you cut through all the confusion and help you find the plan that works best for you. Well, that's it. That's about everything that you need to know before you're turning 65. Of course, there's a lot more about Medicare than just that, but this simple checklist covers the basics that you need to know. Remember, you don't have to be an expert in Medicare. You just need to know the important details so that you don't waste money. And then rely on experts to help you. But if you want to take things to the next level and really understand all the ways that you can save money on Medicare, or if you have a specific situation that you need help with, then check out our free Medicare workshop. In it, we cover absolutely everything that seniors need to know about enrolling in Medicare properly and getting the best coverage for themselves. I'll put a link in the description below if you want to check it out. Other than that, thank you for watching, and don't forget to like and subscribe for more simple Medicare lessons.